Welcome back to the channel where we break down complex rheumatology topics into clear, useful insights. Today, we're diving into a lesser-known but important form of arthritis, pseudogout, also known as calcium pyrophosphate dihydrate deposition disease, or CPPD. Before we begin, this video is for education and inspiration only. It's not medical advice. Be sure to consult a healthcare professional and double-check information with trusted sources. So what is pseudogout? It's a type of crystal-induced arthritis caused by the deposition of calcium pyrophosphate dihydrate crystals in joint cartilage. When these crystals shed into the joint, they trigger sudden inflammation. Kind of like gout, but the crystals are different. Instead of uric acid, CPPD crystals are rhomboid-shaped and positively birefringent under polarized light. These crystals tend to develop in aging cartilage or when the body is under stress, like during illness, trauma, or surgery. Who's most at risk? Pseudogout typically affects older adults, usually over age 60. But it's not just aging. Several metabolic conditions increase the risk, including hyperparathyroidism, hemochromatosis, low magnesium levels, hypothyroidism. What does it look like clinically? The most common presentation is acute monoarthritis, sudden pain, swelling, and warmth in a single joint, most often the knee. But the wrist, shoulder, and ankle are also common. Symptoms can easily mimic gout or even septic arthritis, so it's often missed. For diagnosis, the gold standard is synovial fluid analysis. Under the microscope, you'll see rhomboid-shaped CPPD crystals that show positive birefringence. X-rays may show chondrocalcinosis, calcium in the cartilage. And don't skip the blood work. Check for thyroid dysfunction, low magnesium, or iron overload. Now let's talk treatment. For an acute flare, management is similar to gout. 1 NSAIDs if tolerated, 2 colchicine, especially if started early, 3 corticosteroids, either oral or injected into the joint. 4 joint aspiration can relieve pressure and confirm the diagnosis. For chronic CPPD arthropathy, there's no cure, but you can manage symptoms with physical therapy, analgesics, periodic steroid injections. If flares keep recurring, low-dose colchicine can be used preventively. And always look for and treat any underlying metabolic causes, especially in younger patients. Key takeaways: pseudogout isn't gout, but it's just as painful. Diagnosis needs crystal analysis. Knees and wrists are most commonly affected. Don't forget to run a full metabolic workup. Treatment is effective, and prevention matters. If you found this helpful, hit that like button and subscribe for more deep dives into rheumatology and autoimmune disease.